Action.
Another day in the coal mine. Oh, my chest hurts. I think I should go see my doctor.
The doctor will see Daniel?
That's me, doctor.
Nasty sound of cough, Daniel. Why do you have a seat right there? Daniel, what can I do for you today?
Well, doctor, I've had this cough. I'm always coughing up stuff, and I'm short of breath. I work in a coal mine.
How long have you worked at this coal mine?
27 years.
27 years? How long would you say this cough became relatively bad?
About 5 months.
About 5 months ago?
Yeah.
You smoke, Daniel?
3 packs a day.
3 packs a day? How many years?
10 years.
When was the last time you've been to a primary care physician?
Oh, it's been a while.
Been a while? Since you've had a checkup, okay? Now at work, are they having you guys wear masks or any kind of protective thing?
Absolutely not.
No? And are you right in the middle of it? Just
Oh, right.
coal dust flying around, all of it? Okay?
Oh, yeah.
Okay, Daniel, we're going to do a couple tests today. I'm just off what you're telling me, your work history and all your symptoms. I believe you have pneumoconiosis, which is it's relatively kind of common occurrence in people who work in mines or factories and things like that where there are particulates in the air. So I'm going to have to do a couple of examinations to kind of rule out some other things, maybe check your lungs, and we'll get started on a treatment plan, okay?
Sounds good, doctor.
All right, Daniel, your blood pressure seemed pretty reasonable. Okay? I'm going to give your lungs a listen to, all right?
Okay.
Okay, I'm just coming underneath. Just breathe in and out every time. Oh. Okay.
I'm sorry, doctor.
Let me just give back here a quick listen. Okay, Daniel. So, based on your medical history and what I've just done, I was able to kind of rule out any chronic bronchitis or emphysema that you might have had. But I'm going to send you for a lung biopsy and a CT scan, and we're going to see if it's pneumoconiosis. It's just what it is. All right?
Okay.
Danny, how are you?
Okay, doctor.
Feeling any better today, or about the same?
Not too much.
Okay, I have your lab results here. And just like I suspected, it's pneumoconiosis. Are you familiar with this disease? Do you know what it means?
No, doctor.
Okay, it's a workplace-related lung disease. Essentially, Danny, when you're in the coal mines, blasting away at rocks and pieces of coal, little particles are getting in the air, okay? When those particles are big enough, they can prevent your lungs from properly expanding, okay? There is no direct treatment for this disease. I'm gonna prescribe a corticosteroid to help with inflammation, and I'm gonna recommend you for pulmonary PT, okay? First things first, stop smoking. All right, that's only gonna exacerbate the symptoms, and we're gonna have someone else come in and tell you other things you can do around work to make it less harmful for your lungs, okay?
Okay, doctor.
Any questions for me?
Nope.
Okay.
Hi Danny, how's it going today?
Okay.
How you feeling?
Not great.
Okay. I'm Mason, I'm your physical therapist today. I have a physician's referral for treatment for respiratory therapy for pneumoconiosis, okay? So did your doctor do a good job of describing what that condition is and everything for you?
Yep.
Okay. Alright. So my plan here today was to kind of help you out and teach you some different interventions and techniques that are going to help with all that coughing and congestion you have currently with your condition, okay? Do you have any questions so far with anything?
No.
Okay. So the main thing today that I wanted to go over was teaching you a huff cough. It's going to be a lot easier on your throat, and it's going to be a very effective way of getting out any mucus you have in your lungs. So the first thing I'm going to do here is get you a tissue to cough into. So essentially what we're going to do here, the main difference is I want you to keep your mouth in an O shape, which is going to relax your jaw, and you're not going to be building the intra-abdominal and chest pressure that you do when you normally cough. So essentially what I want you to do here, I'll demonstrate it for you first, is keep your mouth in an O shape and almost pretend like you're going to fog a mirror. So when you feel the need to cough, I want you to lean back, have the tissue right out in front of you, and then it's going to be mouth in an O shape and just like that, okay?
Just like that.
So nice and short, and I don't want to hear any wheezing with it. Should hear some mucus coming up, and whenever you feel the need to get that mucus up and out, just spit right into the tissue, okay?
Okay.
All right, so whenever you're ready, give that a shot. So a nice deep breath in. Okay, so we're gonna try that one more time. Just keep it nice and short. Try and have the mouth in a little bit more of an O shape, and then we'll try it one more time. Again,
Okay.
try and lean back, open up the chest a little bit more, sit up nice and tall, head nice and forward, okay? Okay, all right. So that was one of the techniques I wanted to show you today. Another thing would be whenever you go home, make sure you're drinking a lot of water. That's going to kind of help mobilize any of those secretions you have, get them up and out a little bit easier. Especially if you're working in a coal mine all day, it's very good to stay hydrated. And then it says here you were a smoker beforehand. Have you cut back on your smoking at all?
Oh, I'm down 2 packs a day. I just can't quit.
2 packs a day though? Okay, what were you at before?
3.
Okay, awesome. All right, so cutting back there. So essentially, we're gonna keep rolling with some respiratory therapy here, and we're gonna monitor you throughout the duration of therapy. So we'll try for around 2 times a week for the next 6 weeks. Okay.
Okay.
All right. It was great working with you today. All right.
Are you Daniel?
Yes, I am.
Hi, Daniel. I'm Josh, the safety inspector. How you doing today?
Not too bad.
Not too bad. All right. So I heard you're going to therapy, just to get rid of some of that stuff you got built up in those lungs. Is that right?
Yep.
All right. So I'm here to teach you some preventative measures that you can possibly teach your colleagues, and how to avoid this situation and maybe make it a little bit better on yourself. All right.
Okay.
So the first thing I'm gonna teach you is to use a respirator at all times. While you're in the coal mines, the dust gets in the air. That respirator is gonna help you breathe, and it's also gonna allow you to breathe in clean air as well.
Okay.
Number 2 is that you should always be taking frequent rest breaks outside of the mines that you're digging. Try to get some clean air into those lungs. The third and final thing that I'll tell you is that you always need to stay hydrated. Hydration is key to having clear lungs and being able to move those secretions out that you seem to be coughing up.
Okay.
So in order to do this, like I said, continue to hydrate. Respirator and frequent breaks. And if there's one thing I can teach you, it's always to remember, for you to stay young, get away from the black lung.